What is up? What is up, everybody? Welcome to another episode of the Insomniacs Livestream with your host. That is right, me, Dr. Andrew Kim, MD. I am a board certified psychiatrist. And for all of you subscribers to my channel, for those of you who are still up this late at night on a Saturday night instead of being out and about listening to me, thank you very much. And if you are not subscribed to me, please subscribe, follow my channel if you enjoy mental health related content mixed in with pop culture that we kind of tend to talk about on our live stream. So let's dive into it. So, look, this is on demand by some of the core followers of this live stream. So today, we ended up kind of going off on a tangent in our last live stream and started talking about kind of the interplay and the crossroads of religion and mental health, and religion in the field of psychiatry or therapy. So let's get into it today. So we are going to talk about kind of the crossroads of religion and mental health. And I really want us to have kind of a fair and balanced discussion about that because I think there is kind of a divide, and there's probably a difference of opinion of what religion's role is when it comes to mental health treatment, its relationship to therapy, psychiatric help. And I think it's kind of like a double-edged sword, and it can kind of cut both ways. So why don't we kind of talk about how religion or spirituality can sometimes almost act as a barrier to mental health care or well-being due to a variety of factors, whether it be cultural, doctrine, societal influences through the context of religious organization. But let's also talk about the positives and how there can definitely be, I tend to hate this corporate word, but like synergy, right? Synergy between mental health and religion complementing each other. So let's talk about that. And of course, along the way, I would love to hear your comments. I'd love to hear your own opinions and your own experiences on kind of this. And as we go along, I'm going to try to read off some kind of bullet points about both sides of that double-edged sword, but also kind of sprinkle in anecdotes of what I've seen from the position of a clinician or a treater, being a psychiatrist, and also just personal things in my own personal life, things I've seen with people in my life, just to kind of sprinkle in that personal touch. And let's talk about it. So, and at the end, after we kind of talk about these positives and negatives, some bonus content. This is a shout out to Lisa on the West Coast in the Northwest, who also asked a comment about, how does one, it doesn't necessarily have to be in the context of healthcare, but I think she was asking in the context of healthcare, how does kind of one approach that very challenging conversation with someone when they are angry at God in the midst of a healthcare tragedy, whether it's their loved one, their child has died, passed away, or had some tragic, terrible outcome? Like, how do you broach that topic when someone is in the midst of tragedy, pain, and is angry at God, which is a challenging thing. So I said, let's weave that in because it's kind of on demand from one of our frequent listeners to this topic today, religion. So let's talk, again, that double-edged sword of that crossroad of religion, mental health. How about let's talk about how sometimes religion can almost act as a barrier to mental health care. Well, first of all, I do think, not always, but it's so variable, right? Certain religious teachings, depending on the church, depending on who leads your church, your religious organization, there can be a stigma around mental illness itself, right? Some religious communities may view mental health or mental health challenges as a sign of personal, spiritual weakness, a lack of faith, maybe even sin itself being evil. And that stigma can discourage individuals from seeking help out of fear of judgment, fear of ostracism from the flock or the conformity of that group. I think this is true. Look, I experience this as a treater. I witness it, maybe is the more appropriate term, on a weekly basis with the patients I see, even in this year right now, 2024, right? Stigma can discourage patients from being as forthcoming as they might want to be. For example, the topic of suicide, right? Very common topic that I discuss a lot with my patients. And when we get to that topic, right, I try my best as a clinician to say, look, the reason I'm asking if you're having any thoughts about death, dying, thoughts about wanting to end your life, to kill yourself, thoughts of suicide, thoughts of non-suicidal self-injury as a means of coping, is because I want to understand you, right? I'm coming from a stance of curiosity. I need to understand these things to better understand you, your pain, your struggles, not because I'm going to judge you in some way. That's not my role. My role is a psychiatrist. But oftentimes, even with a lot of that prefacing and even with that rapport building attempt that I try, it's often met with, especially for those who have not just, I don't think it's necessarily those only who have, certain religious or spiritual beliefs, but I think especially those who have kind of traditional religious beliefs. I get this kind of fearful shaking of the hands, shaking of the head. Oh, no, 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 I would never, right? And listen to that tone of the voice, right? I would never, as if that is a horrific sin to even think about suicide, to even be in a position to have a transient thought of vulnerability, of feeling overwhelmed. And I try my best to make it clear to them. I said, look, that's a sign that you're human. I think people get shocked when I go over stats sometimes of how many people struggle with transient thoughts of suicide, how many people struggle with chronic thoughts of suicide and go about their daily lives, and you'd never know because they're not necessarily vocalizing it out loud. And any stats that we have are underestimates. They're gross underestimates. When people say I can't relate to that, I kind of give a puzzled look. Oh, really? Because it's pretty much ingrained into human nature that we have moments of vulnerability like that. I actually don't find it odd at all. Many people say, yeah, at some point in my life, I've struggled with that. Yet, that is an example of how stigma can even become a challenge with basic communication, even in intakes and interviews with a psychologist, psychiatrist, therapist. So, that's the stigma is still there. So I don't think that's just a buzzword and things you're going to read on blogs. Stigma is still there. Now, another way that religion can maybe be a barrier sometimes is maybe an over-reliance on spiritual solutions. In some religious organizations and some traditions, mental health issues may be framed as a spiritual problem. This is a punishment for your sin. This is a test of your faith. This is God trying to teach you a lesson. This is literally maybe even sometimes portrayed as demonic possession. This can lead to maybe, again, keywords. I'm not saying these things in themselves, there's a problem per se, so please don't get me wrong. This can maybe lead to an over-reliance on prayer, on fasting, on religious rituals, exorcisms, while neglecting evidence-based medical or psychological treatments. And for those of you who don't know me, if you're a first-time listener, please realize, I grew up in a Christian household. I grew up going to church. I still believe in the core values and beliefs of Christianity. I would say I have a strained relationship with organized religion and the organized church at this point in my life for various reasons that don't want to bore you with, but I still identify as a Christian at the moment. Okay. And so when I'm talking about these things and kind of the potential barriers, right? This isn't some, religion, Christianity, Islam, Judaism, these are wrong or evil. I'm just saying, again, it's a balanced conversation of how they can be in certain scenarios. for certain people, for certain groups, right? So again, next principle. Sometimes there may be in some settings, and we'll talk about the opposite later, a lack of integration with mental health professionals and a religious organization. Some religious leaders, institutions, elders in the church, elders at the mosque may not necessarily want to partner with local advocacy groups, mental health organizations, clinics, hospitals, especially if those professionals are perceived as being kind of outside the faith of that particular group. Maybe they're promoting practices, that aren't in line with the values of a particular faith, promoting beliefs that are just incompatible with religious beliefs, right? Look, I've witnessed this before too. This isn't hyperbole. This isn't hating on churches or church communities. I've had patients of mine who decided to leave intensive treatment programs, whether it be an addictions program, an intensive outpatient or partial hospital program where they were coming 5 days a week, either because they'd just been released from the hospital and had transitioned to this, or we were doing this type of program to hopefully prevent a hospitalization, intensive programs for those who are very in need, and sometimes dropped out on their own or almost coerced out, it might be the better word. And sometimes when asking the patient or a group of people they brought with them to have a group meeting with me saying, look, we appreciate your attempts at help, Dr. Kim, but right now they don't need this therapy. They don't need medications. We are going to be doing intercessory prayer. We're going to do quiet time. We're going to read some scripture. That in itself is enough. Sometimes it might be, but other times I'd say, hey, I'm sorry, this individual has schizophrenia. They have pretty overt, flagrant bipolar disorder, conditions that are going to need medication management, likely for the long term, more than likely chronically. I'm not against communal support. I'm not against prayer. I'm not against spiritually nurturing somebody, because I believe in trying to understand and heal our patients mentally, physically, spiritually. But if you kind of neglect obvious things that they need that could really help this individual, that is very concerning, almost jeopardizes and puts their health at risk. But I've seen it. I've seen that happen. Kind of going along that vein would be another principle of, the fear that some religious communities have of the mental health field having contradicting contradicting their faith-based values, right? The concern that, that individual, or you may go to see a therapist, a psychiatrist, and that discussions about sexuality, gender, existential concerns, marital topics, like a therapist or psychiatrist saying, hey, if right now, if divorce is what makes sense and seems healthiest to you, then that's what you might need to pursue. And a pastor or a minister might say, divorce? Some might have the same mentality of what I just said. Others, trust me, will not. And will say, are you kidding me? That's not what you're supposed to do. Divorce? No way, right? And I've seen both ends of that spectrum being preached, right? And again, for or against, there's no binary for or against that topic. I'm a Christian. I went through a divorce. I'm on marriage number 2 right now. And I kind of shared in one of my previous live streams, that was not an easy decision for me. I went through tension internally, externally, religious discussions, in my own mind, in my own heart, people I consoled in, family, non-family members. So trust me, it's a topic that hits close to home for me, reflecting even back on my own life. So Well, yeah, thank you for a lot of our core listeners are here. Dennis is here. I appreciate you joining. Dennis, Carrie is here, Andy's here, and Andy, one of our regular listeners, says, "What if the availability of therapy, medication, etc., is the answer to prayer?" Exactly, and that's what we'll get to in just a couple of minutes. I'll try to zoom through the rest of these on the kind of negative end of the spectrum. Why do these things have to be exclusive of one another? Definitely a question I've thought about. Definitely part of that kind of commentary has been woven into conversations I've had with individuals and individuals' loved ones. And, the last couple of things would be, kind of the social pressure, the conformity in tightly knit religious communities, in a tightly knit, church, etc. Individuals may feel pressure, right, to conform to the group norms, right? That can lead to a suppression of talking about mental health struggles and problems with the fear of being perceived as being different, the outcast, the outlier, and not living up to those communal standards, right? And another topic is trauma associated with religion. I know that's a word that's thrown around quite loosely these days, but I'm being serious. Trauma associated with religion, right? For some individuals, religion can be a source of trauma, right? Sometimes it is literally overt, right? Overt violations and abuse. You've heard the myriad of stories, right, in the Catholic Church with uh, abuse from priests. I mean, that always makes headlines. Trust being broken, psychological, emotional abuse, abuse of power, abuse of power and dynamics. And this can complicate one's ability to seek mental health support, seek help even within that religious community itself, especially if somehow now they're going to associate therapy with judgment or control, because now, right, there may be this transference or countertransference of, I sought help from this authority figure and trust was broken. I was actually hurt. I was actually abused. Now I'm going to put my faith in this other mental health figure. Oof, no thanks. Right. And obviously, there may be trauma about topics of gender, sexuality, marriage, certain sins and behaviors, right? Addictions, porn, gambling, drinking, drugs. I can't talk about. I opened up to my small group about my drug problem, my gambling problem. And look how they responded, right? Again, personal note, right? To make it clear, right, that I'm not just throwing this out there as trauma as a buzzword. Look, my ex-wife had a lot of mental health struggles. I'm not going to throw out all the dirty laundry, but her mother passed away and died by suicide, unfortunately, tragically. My ex-wife, she already had a very strained relationship with the Christian church at the time we were dating, time we got married. I had a decent relationship with the church at that point. And one day, because she's trying to meet me where I'm at, was at a sermon at church. And during that sermon at this Korean American church in the suburbs of Chicago, the pastor just kept hammering home. I can't even remember exactly what the main topic of the sermon was about, but kept hammering home the topic of anyone who takes their own life, anyone who dies by suicide is going to hell. They are going to hell, and they are in hell. My ex-wife, at that time, my wife broke out just into tears while we're sitting in the pew in the middle of the sermon, thinking about her mother who had passed away. Right? And again, I'm not sitting here to debate with anyone what does scripture truly say? How should we interpret that? I know that's already going to be a very controversial topic amongst Christians, right? Oh no, they are going to hell. Dr. Kim, what are you talking about? And others will say, no, God is so loving and merciful. Who knows? In the unknown, we would hope that there is grace to have this more comforting vision of what Christianity might preach. And honestly, I don't know. I don't know what's accurate, what's not. Who knows? It's more about the concept of what I said earlier, that trauma can happen in the midst of religion and spirituality, right? And so imagine then, right? I already said there was a strained relationship. This person, my ex-wife, is trying to meet me where I'm at, compromising, coming to hear the sermon, and that's the topic that's talked about that day. It is trauma. It isn't melodramatic, but that was very traumatic. And imagine what happened to her viewpoint of wanting to ever go back to church with me, wanting to explore Christianity or spirituality. That was very challenging, right? So we'll end it there, right? I know that came across as being quite negative, but it's to illustrate to you, right? When I read the next set of things that are going to be obviously more encouraging and more optimistic and positive, that I'm not obtuse to what we just said here, right? So again, those of you who've joined, I see some other people joining in. And, I apologize if I'm pronouncing this wrong. Joa says that's so bad for a pastor to say. Well, yeah, I think to be fair, right? You're actually going to get, and I'm not defending that. I'm just saying you're going to crazy, right? You're going to get very different viewpoints. People who are listening to this live stream and hearing that anecdote I gave will say, but what do you mean? That pastor's right. That is what's going to happen to someone who ends their life, right? And others are going to say exactly what you said. That's so bad for a pastor to say. And that's what makes this so tricky, right? Religion and religious organizations oftentimes will say, like, this is meant to unify people, to bring people together, a place of safety, yet it could be so divisive, right? It cuts both ways, and that's why it's a double-edged sword. So, hopefully to address these barriers, I mean, as society keeps evolving, hopefully mental health awareness can increase within the religious communities. I don't think it's going to happen passively. I think it's going to take, intentional action from leadership within those organizations, members within the organizations to demand it. There's got to be a demand. People from the outside offering help and offering assistance to foster and encourage collaboration between mental health professionals and faith leaders, right? To try to provide, what is the point? To provide culturally and spiritually sensitive therapy and interventions that can blend appropriate treatment, but also respect an individual's beliefs. That's the whole point. It's not about this right or wrong, or you're right, I'm wrong, this is better. That it's how do we just help people, guys? Jeez, right? That's the whole point. So let's talk about the other end of the double-edged sword, right? Religion and mental health can complement each other. When you have a collaborative, open-minded attitude, right? And that's what it takes. It takes collaboration with open-mindedness to recognize that each of those things, the religious aspect, the traditional, whatever you want to call it, Western medicine interventions and therapy interventions, can each bring unique aspects of treatment to the table for the sake of somebody's well-being, right? So let's go through a list now on the opposite end of the spectrum. So where these two things can complement each other is helping someone in that journey, right? When someone is looking for that sense of meaning and purpose in life, and both areas, mental health, therapy interventions, religion, spirituality, there can definitely be teamwork and collaboration there, right? Religious beliefs, regardless of what particular religion we're talking about, often offer explanations for suffering, for the purpose of life, how to live your life with certain actions that reflect your values, right? And the whole point of that is to help individuals find hope, resilience during times of crisis, during times of suffering. Now, hopefully, right, this sense of meaning can also motivate people to engage actively in treatment. So, a large percentage of my patients, again, to bring it back to personal life, right, are struggling with a lack of a sense of purpose in life, right? I might be stating the obvious, but I really need to hammer that home. So much of what happens in mental health struggles, guys, is struggles with a sense of identity and sense of purpose. I truly believe that. Not to sound corny, not to sound hokey. The thousands of patients I see per year, thousands, right? Depression, anxiety, neuroticism, addiction, unhealthy codependency, erratic relationships, right? To me, a lot of that ends up being the end manifestation of a deeper struggle. And oftentimes, I would say oftentimes, I'm not going to say all, but oftentimes that deeper struggle is a struggle with identity and a struggle of purpose and feeling like you are living a purposeless and meaningless life. All those other things are almost kind of the window dressing or the end manifestation, but that is the root problem for so many of the patients that I see. And they may not even realize it because it's a hard pill to swallow. It's a hard reality to acknowledge that I feel lost, that I feel empty, that I'm actually not understanding why I should bother waking up and doing what I do each day. I don't even know why I do these things each day. It's easier for me to just focus on an emotion, sadness itself, or things that I'm lacking, or things that I lack in comparison to others. That's an easier thing, a more concrete thing to wrap your mind around and focus on in the troubleshooting versus saying that abstract existential problem of, I don't even know what the hell I'm doing. And that is a scary thought to think about. How many of you right now, as you're listening, live or recorded, are in the midst of that struggle, right? What is the point of all this? Is this what I'm really supposed to be doing with my life? I feel like I'm just going through the motions. I'm in a rat race. I don't even find anything fulfilling, meaningful. Yeah, I laugh, I smile, I have a good time. You know, I don't know where I'm. It's a scary feeling, and I know I've said this phrase, guys, but our society, we don't like talking about this, right? And even when we talk about it, you know what I'm talking about. You've seen these books in the aisles of your coffee store, at Starbucks, at Barnes and Nobles, right? These catchy titles, right? Quarter life crisis, midlife crisis, empty nest syndrome, right? Those are euphemisms. Those are euphemisms for I am lost. I don't know what the hell I'm doing. I am scared as hell. But what I just said there, those sentences don't sell books. Okay, so you gotta use these catchy little euphemistic phrases, right? But so our society recognizes that we are all struggling with identity and purpose, right? But we try to diminish and lessen the blow by using cute terminology and euphemisms. But it's there. You can see it. It is there. You see it in others. You see it in yourself. But that's what I'm saying, right? Mental health interventions with therapy, religion, spirituality, for the appropriate person in the appropriate chapter of their life, these can mesh together to be kind of the multiple vehicles or mediums to help shape purpose, meaning, or at least be a vehicle to help them on the journey to find that, right? So, again, even from a non-religious perspective, it's a very common therapy modality and interventions to say we're going to be doing kind of value-based therapy. We're going to do interpersonal psychotherapy, examining your dynamics with other people, your relationship with yourself, reflecting on your identity. And it's a question I'll get a lot from my patients, like how? Well, how do I shape my identity? How do I really know what I believe? And how do I know it really resonates with me? And I say, look, my answer is nobody likes my answer, but there's no formula to shape your identity. There's no formula to know exactly what you hold dear to you in terms of value. You got to live life. You got to live life. You got to experience life. You got to be vulnerable. You got to go meet people. You got to go learn things. You got to go experience things. And part of that introspection and part of that journey of living life may involve examining spirituality and religion and reflection, right? So this is where these things can meld together. Okay, off my cheesy tirade, okay? So another positive aspect, right, could be offering community and social support. I know that sounds very rudimentary, but look, being part of a community, being connected to other, whether that's literally sitting together, communing together in a church, for a sermon, for worship and singing, for group activities, for reflections together on a Friday with Shabbat, reading scriptures together, religious texts, community support can address loneliness and isolation. And loneliness and isolation are another linchpin, right? I said identity, purpose, but also loneliness, lack of connectedness is a common factor and a unifying linchpin in mental health issues like depression and anxiety. Okay. Am I lying? Am I making this up? Am I making this, is this hyperbole? A recent American Psychiatric Association poll in 2024, their Healthy Minds poll that they put out every month, cited that 30% of Americans aged 18 to 34 feel lonely every day. I didn't say once in a while. I didn't say in some chapters of your life. 30% of Americans ages 18 to 34, you're saying young, vibrant, very social, connected on social media, right? Are lonely every day of the week. I think that's an underestimate. I imagine if you said, how often do you guys feel lonely? Once a week, twice a week, that percentage would be even higher, would be my guess. Maybe I'm wrong, but that would be my guess. Loneliness is a universal human struggle. Loneliness is a plague that knows no socioeconomic, geographical, ethnic, racial boundaries. Loneliness is one of the least racist things out there, guys. Okay? That affects everyone because unless you are the whatever point something percent of true folks exhibiting psychopathy or sociopathy, the other 99 point something percent of us, we are wired. I am telling you, we are wired to want to be connected with other people. When I say connected, I'm not saying we're wired to want to be married in the traditional husband and wife and husband and husband and wife sense. I'm saying we are wired to want to be connected in some shape or form. We were not meant to be living in isolation, the vast majority of us. So whether you find that fulfillment to scratch that itch and meet that need, that universal linchpin of connection, whether you fulfill that through platonic friendships with coworkers, with peers, with your family, with platonic friends, romantic relationships, I am telling you, we are wired for that. We're not always going to be successful, though, of having those kind of healthy bonds. And this is why loneliness is so prevalent. Isn't it crazy how in the advent of social media, we talked about social media last time. Isn't it insane with all of the social media apps out there, how you can reach people across the globe? I can go message someone in Korea right now, right? DM them and get an instant DM back. DM my relatives who are in a different state. Yet loneliness is so prevalent. Even social media and technology have not solved loneliness, guys. So I said money can't solve it. Technology hasn't solved it either. So this is, again, where people can alleviate, and you can talk about this topic in a therapy setting and leverage that unique person's religious and spiritual beliefs and say, is there a way we can learn more about what opportunities there are, right? Where we can try to foster for you, as long as you're willing to have this conversation, religious and spiritual connections with your community, with God, with Allah, right? Whoever it may be. There is an opportunity there. Can religion and spirituality blend with mental health interventions to foster positive coping mechanisms? Absolutely. Religious practices often promote things like reflection, prayer, meditation. They preach forgiveness, gratitude, altruism, and acts of service. These things, right, that I just listed for you, what is that about? It promotes emotional regulation, stress reduction, distress tolerance. It can enhance overall mental well-being. And these can reinforce things that are taught in mental health care, right? How many of those things that I just list about, forgiveness, grace, self-compassion, gratitude, you've heard these buzzwords, right? You read a wellness blog, you follow these wellness influencers, and those are the buzzwords you're going to hear nonstop. And No surprise. These things are preached in a lot of different religious contexts, right? And look at the synergy that already exists. Some aspects, right, of mindfulness, which is a huge component of Zen Buddhism, have been incorporated into dialectical behavioral therapy, DBT. DBT is a specific modality of therapy that is geared towards borderline personality disorder, or at least folks who exhibit certain features of borderline personality disorder, chronic self injury. Mindfulness is a huge component of that. And they literally, it's not even, oh, by chance it happened. They explicitly said, hey, we're going to meld parts of cognitive behavioral therapy, a more than half century old form of therapy, with principles of Zen Buddhism. That was an intentional thing that was done. That's a perfect example of how there can be synergy between these two things. People have studied, even for clinical research purposes, right? Trying to understand the benefits of prayer. Sometimes prayer has become a strategy for some individuals to achieve a more relaxed state, feeling less anxious, feeling more connected and less alone, feeling less stressed. They've even done some studies to show maybe a loose correlation between lowering cortisol levels because of being less stressed and relaxed as a result of prayer. Again, loose studies, but again, another tool to help with these general states of mind and emotion. So even using some of these actions as strategies for relaxation, de-stressing, coping, etc. And there can be a blend of mental health interventions and spirituality, religion, encouraging accountability, structure, the community I already mentioned. Religion often emphasizes discipline and routine, right, through following practices and rituals, guidelines. And where do we see kind of a unique blend of this? Again, it's not a perfect organization, but AA, or Alcoholics Anonymous, is one of the best examples of that blend, right? AA is not necessarily a religion, but they incorporate and weave in some aspects of spirituality, giving yourself up to a higher power, practicing some radical acceptance of things that are out of your control. That structure and routine of going to meetings, whether virtual or in person. Not always, because there's different subtypes of AA groups, but sometimes they have the 12 steps version of AA and giving you scaffolding or a structure to follow. Perfect example of what I'm talking about how there can be a blend of taking principles of mental health, spirituality, and religion with accountability and structure. Right? Last few things, right? On the one-on-one level with a therapist or psychiatrist, right? That there is a chance that you can enhance therapeutic rapport through spiritual sensitivity, right? When a therapist integrates or respects a client's spiritual beliefs, it could strengthen that therapeutic alliance, right? That patient might feel much more aligned, with their therapist, because they understand that they truly are listening to me. They're not just hearing the words coming out of my mouth, they're actively listening. They want to connect with me more than just a superficial level. And why is that important? Because that rapport and trust is so important. It's a fascinating topic. We could talk about it on a different day, but trust is such an important component of the therapeutic alliance. Some studies have suggested that in therapy-based outcomes, sometimes it was really one of the highest correlating factors of better outcomes was trust in your therapist. It actually didn't even correlate with the patient saying, do I perceive my therapist as the smartest, most intelligent therapist? Do I think they're better trained than the average one? How highly they ranked what school they graduated from, what program they graduated from. The common finding was that, do I trust that we have a healthy relationship? Do I trust that my therapist actually cares about me and is looking out for my well-being? And part of that trust can be about the spiritual sensitivity, developing that rapport with one another. I do believe, kind of what we said earlier, themes with spirituality and religion and mental health kind of overlap in a Venn diagram, right? Supporting the concepts of forgiveness, emotional healing, self compassion. How are these things not aligned? I'm going to be brief here, right? So many therapies promote radical acceptance, self compassion, grace. There's even specific therapy modalities just built on some of those principles. And, what are some of these religions preaching? A lot of those same things. So, even from a value standpoint, there's an overlap, right? So, all of the above, right? Hopefully, that gave you a viewpoint from both perspectives, right? The barriers, the stigma, the trauma, but how sometimes, right? If one can look, taking a step back, these things don't have to be at odds with one another. This can serve as a vehicle or a medium where a clinician can connect with their patients. It could be used as a strategy, and you can leverage aspects of religion, whether it be the actual community components to help with isolation and bonding, whether it be about values to explore your identity, your values, etc. And hopefully, there is a way to use those two things to build resilience during crises, to support people when they're struggling, right? And I truly believe, right, we always talk about the mind body connection to address mental health, physical concerns, take care of your body, go see your doctor to take care of your medical, physical health, go see your psychiatrist, therapist to take care of your mental health. But why not include mind, body, spirit, right? People who preach holistic care, right? Shouldn't it be truly holistic, not also ignoring kind of the spiritual aspect as well? So, but again, guys, so whether you comment here in the chat, in the comments section, if you're watching this recorded, I'd like to hear about your own experiences, right? I tried to share some snippets throughout about some of the, traumatic experiences that one could go through, how certain interventions already are trying to meld together aspects of both domains, whether it be AA and individual therapy, etc., but also how sometimes they can be at odds with one another. So again, trying to talk about both aspects of that double-edged sword. So please share, and then let's kind of wrap up in these last 10-15 minutes with a special segment for Lisa, who may or may not be on the live stream today. But if Lisa, if you're listening on the recording, Lisa asked in our last episode, how do you kind of respond? Let's say someone who believes in God or a higher power, doesn't have to be the Christian God, but God or a higher power, another entity or deity, and they're angry at that in the midst of a tragedy, some form of a healthcare tragedy. Someone passed away, someone died of a medical illness or disease, complications, accident. What do you do? They've expressed anger, disappointment, discouragement, shaking of their faith. How could God do this? If God or Allah, Jesus, whoever, if they're so loving, how could they take my wife from me, my husband from me, my child from me, my relative from me, my friend from me? How could they cause mass destruction and natural disasters, right? How do you respond? Let's go through some general suggestions, guys. So, number one, first and foremost, acknowledge their pain. And when I say acknowledge their pain, the buzzword should be validation. Again, I think people misinterpret that term. Validation doesn't mean you agree with an individual. You don't have to agree with an individual to validate them. Validating is basically conveying, I hear what you are conveying, not just words coming out of your mouth, but you are angry. You are in pain. Right? How you can validate the experience that they're going through without even necessarily having to agree with them. So acknowledging their pain is a form of validation. Say, I can see you're deeply hurt by what's happened. And that's very understandable. I can see that you're deeply hurt. You are in pain. I'd avoid trying to quote unquote fix their emotions or fix the issue, trying to offer immediate explanations, because that can come across as dismissive. And the question is, when you try to do that, is that more about you? Is that about you trying to soothe your own discomfort, sitting with this flood of emotions that's in the room, the tension that's there, the discomfort you might feel because you're not sure what to do? It's hard to sit observing and palpably feeling someone's pain just pouring out. So are you soothing your own discomfort? Are you wanting to be just seen and perceived as being helpful? It's probably more helpful to validate and acknowledge their pain than trying to offer instant solutions with words coming out of your mouth. Next, create a safe space for expression. Let them share their feelings. Let them share their thoughts without interrupting them. Don't have to pour unsolicited advice. You don't have to fix it. Just, I'm here to listen. And be inviting. If you want to talk more about how you're feeling, your anger towards God, towards whoever, I'm here. I'm here to listen. Can't solve it, can't fix it, but I'm here. And again, that goes back to the concept we talked earlier, connection, loneliness. I don't have the answers for you. I know I can't take away your pain, but I want you to know you don't have to be alone. I'm here. I'm going to be here with you listening. What else could I do? Another tip would just be to avoid theological arguments, right, guys? I mean, I'd say this is not a time to get into a debate with that individual when they're writhing in pain, emotionally and spiritually, trying to defend God. No, God's loving, God's loving. Just focus back on, again, their experience and what they're going through. It's okay that you're questioning things. It's okay to say that you're having doubts about what you believe in. Did you say God sucks? God's evil? This deity sucks? No, you're just saying it's okay that your beliefs are shaken, your faith is shaken. It's okay that you're feeling this way. Be empathetic, everyone, right? Be empathetic. Avoid empty platitudes. It's all part of God's plan. Everything happens for a reason. I know that's not coming, more than likely, I know that's not coming from a place of malintent or maliciousness, but imagine how at times that might come across as dismissive, hurtful, flippant, right? If someone went through an experience where they just lost their infant, right, to SIDS, their 3-month-old died of a cardiac malformation and a complication during surgery. And you said, it's all part of God's plan. Don't worry. It's all part of God's grand design. I know I gave you an extreme example, but look, I'm giving you an extreme example to prove a point. You don't think those words were uttered in a scenario like that ever in life? Of course they have, right? And I know that was an extreme example, but how is that individual going to respond to that? More than likely, they're not going to say, well, praise God. Hallelujah. Right? And again, I'm not saying these things to come across as anti-religion, anti-Christian, anti-God. I'm just saying that's probably not the time and place to throw empty platitudes. Because again, is that you soothing your own anxiety and your own discomfort, or are you truly doing that as a means of trying to be there for that person and heal them? Right? Start with validation, space, empathy, active listening. Now, I'm not saying, look, be paralyzed to not offend somebody. No, I'm saying offer your perspective if they invite you to, right? If they say, hey, what do you think about this? What do you think about me being angry? Do you think this is normal for me to be struggling? If you're invited to and they explicitly are saying, hey, I want your opinion. What do you think about that? Okay, there's your window. There's your window, right? It's important to remind them they're not alone. Again, back to that theme of isolation, right? Encourage them, whether it's with you or with others. Say, hey, are there other people that you can lean on? This is the time to lean on them. You want me to call your family for you? You want me to call your other friends for you? Again, asking if they want that. Anyone else we can tap into, right? If anything, let me help you reach out on your behalf. Something very practical and pragmatic, right? Who else can I involve to help out? I'm just trying to support you. Respect the process. I know that's a cliche thing. Respect their process, respect their journey. You know, they might step away from their religious practices, their routine, the church, the mosque, the temple. It may take time for them to heal, to reevaluate, to come back to the fold. Everyone's going to respond differently. Everyone's going to have different timelines. So as cliche as that sounds, even when we talk about in the sense of mourning and grieving, it's true. That's why we say it so often. It's true. There's no playbook for this, right? Offer practical support. Hey, when's the last time you slept? What can we do, right? You're worried about your kids. Can we babysit so we can give you a chance to nap, to recover? Hey, can we get you something to eat? Hey, do you want us to pop in so we could check on you, check on the rest of your family? Practical. Guys, actions speak louder than words. Another cliche phrase, right? Actions speak louder than words. Okay? And look, if there's an opportunity, if they ask you explicitly, hey, will you pray with me? Will you read some religious text with me? Someone asked me in the last live stream, is it ethical for me as a psychiatrist to pray for a patient? To give my opinion about something from a spiritual or religious perspective? My response was, if I'm asked, and if that's what they want me to chime in on. I'm not going to insert that, but if they ask me, I'm going to answer them. They say, hey, do you have any religious beliefs, spiritual beliefs, Dr. Kim? Yeah, I identify as a Christian. Okay. If they say, hey, I'm a Christian, are you a Christian, Dr. Kim? Yeah. How come? What makes you ask me? Say, would you pray for me, or would you pray for me on your own? Could you say a prayer with me now? I said, is that what you want? Just to confirm? Yeah, I'll do it. I didn't insert it. I didn't coerce them to ask me to do that. I didn't burden them with that. They were asking me. And if it's something that lines up with my values, okay. They're the ones who consented to it, right? So same thing in your scenario without even being collision. If they ask you and it's something you feel you're comfortable doing with, that's your window right there, right? So I'm not saying be a mute, be a mime. It's about validation, empathy, listening, pragmatism, basic principles, right? But sometimes we get so thrown off by the tension, the tempers, the emotions, how intense it is. We get frantic. And I've probably been there. I've probably said some of these things. I'm not some therapist supreme, right? I say, oh, Don't like God's a loving God, right? Trust me, none of us are perfect, right? None of us are going to be uh, validation experts all the time, right? And you can't control whether someone gets offended or not. We're not striving for perfection, right? So a few comments have come in, right? It says, Chuckles, thank you, Chuckles, for joining in. Chuckles said, all tools are good. Yeah, I'd say, look, when someone's suffering, we got to be practical, throw the kitchen sink at that sucker, right? So whether it's the spiritual angle, tune up your physical health, your mental health. Chuckles also says, lately I'm tested with waiting. It's frustrating, but I believe the gifts of God will be delivered. Yeah, no, feeling like our faith is being tested, feeling like we're being tested, feeling like we are being given more than our cup can handle, right? To bring in some general scripture, right? It's very trying and it's very testing, Chuckles. So another comment that comes in, Joa says, I've wondered about a few stories in the Bible, like the man, woman who was possessed with demons. I've wondered if the person actually just had a mental disorder like bipolar or schizophrenia. Very possible, Joe. Very possible. I mean, who knows? And again, like I said, I'm a believer, right? I believe in scripture, in Christianity, but I know there have been cases, plenty of cases where um, you know, a demonic, quote unquote, a demonic possession, right, ends up being mislabeled chronic psychosis or schizophrenia, schizoaffective disorder, sometimes even epilepsy or partial, like complex seizures, has been labeled as demonic possession because of the contortions and the convulsions that are happening. There are forms of epilepsy where you don't lose total consciousness, but you still may have motor movements that look very awkward and scary from a layman's person's point of view. And they're like, oh my gosh, they're contorting because they're demonic, right? So, there have definitely been cases documented over the course of history where the mental health field, right? So, the mental health field was shunned upon, saying, you don't know what you're talking about. This is a spiritual attack. This is a demonic possession, right? On a totally offshoot tangent, Joe, I actually find that very fascinating, right? I'm not a Catholic. I grew up in the Protestant faith. I know this is like a weird thing, but so I know I'm going off on a total tangent here, but I don't want to get derailed totally. But quick comment here is, I find it so fascinating. I would love. I don't know if love's the best word because it sounds kind of sick and weird, but like I'd be fascinated and intrigued. There you go. That's probably the better word, to have the opportunity to uh, go with, I guess, the Catholic Church, maybe the only one who does this, but I mean, at least in traditional Christian context, or maybe I'm obtuse, maybe that's not the case, to go along to see a case that is deemed a possession. I mean, I just see these things all the time in pop culture and on media, and it seems like they're supposed to have a psychiatric evaluation. Is anyone here? Any of the viewers of the Catholic cloth of the Catholic faith? I mean, is that just some like weird anecdote and mythology portrayed in these exorcist movies, or like if I know it's not like a common thing, but like I do read and hear that like there are some exorcisms that are sanctioned. Like, isn't there supposed to be some step where there's supposed to be a psychiatric evaluation to like deem whether something should proceed with an exorcism? I'm just like, who gets to be the psychiatrist that gets to do that? Do they outsource that, or does it have to be a psychiatrist who is within the Catholic flock? I don't know why, but I've always just had that question. So that was a totally random tangent, Joe, but just kind of an intriguing thing. I'm like, I don't know. Yeah, I guess, I think I've said this strange topic to my wife before. She's like, wouldn't you be freaked out, or that would be so terrifying? I said, I'd actually be more intrigued and just kind of want to know, my curiosity, right? My curiosity about the other side, right? So random, random. So, but thank you for the comment, Joe. So, but anyways, guys, so kind of an interesting topic. I know that it could be just like I said, religion itself can be divisive, not even in the context of mental health. You see it in our politics, right? Religion is divisive in politics and our society in general, whether it comes to gender and sexuality, and even in mental health. But does it have to be, right? Does it have to be? Because I do feel in the Venn diagram of religion and spirituality and mental health, there is a Venn diagram, and there is an overlap of positivity and an opportunity to leverage some of the aspects of both for the wellness of all of us, for the wellness of us and our suffering. So again, guys, I'd love to hear other comments about your own experiences, whether they be healthy, unhealthy, with spirituality, with religion, the crossroads of that with mental health. We scroll up here, see if there were any other comments I missed earlier on. So, yeah, Carrie, Carrie's a regular listener. Carrie says, grew up in Catholicism, but it didn't mix well with my pure OCD. I wasn't diagnosed until I was an adult. But once I was diagnosed, I knew that I had it since I was a kid. Yeah, and that's sad. That's unfortunate, Carrie, right? I mean, that's an example of what I was referring to in the first half, right? In the first portion of what we're talking about. Unfortunately, maybe the minimization or even flat out dismissiveness of the existence of struggles or having certain conditions, right? Sadly, I've heard it with my own ears. Family members of patients of mine, friends of patients of mine, people in the religious community of patients of mine saying, no, you're wrong. There is no, there is no problem. There's no depression. They're just stressed. There's no OCD. They're just nervous and they're stressed. They're sleep deprived. We got this. It happens. Oh, it happens. So I know exactly what you're talking about, Carrie. It definitely happens, right? Dennis has joined us several times. Dennis says, personally, I think that as Freud has lost his grip on psychiatry, there's been more freedom for openness about religion and mental health, both positively and negatively. I agree. Yeah. Freud's a whole nother topic, right? I mean, Freudian analysis, yeah, interesting form of therapy. Dennis also says, I also think that religion can be a source of freedom, growth, and support for people, psychiatrists and their patients inclusive, instead of the tradition-bound view of religion as fostering guilt, control, and dependency. Absolutely. And I think, you're right, Dennis, right? I mean, it's so dependent on the person, who's going through the struggles. It's so dependent on that clinician, the therapist, the psychiatrist, the family medicine doctor. It really depends, right? And it's going to take that unique match, the right people with the right circumstances, where it can be something that can be a useful tool, right? And a useful source of healing if it's the right match. A mismatch, as you say, it can also go terribly wrong, right? It can go terribly wrong. So, and then lastly here, we got the latest comment coming in from Andy. Guilt and shame are so often part of mental health struggles. If God, spirituality are going to be part of the solution, it needs to stay positive. Correct. Right. No, absolutely. And, I mentioned this part last time, right? So forget the mental health part, right? Even religion itself can go in so many different directions, right? And this is why we see so many, at least for those of you who have a Christian background, you should be able to relate to this, whether you're a Baptist or a Protestant or a Methodist or whatever. How many times have you seen churches split, right? A church split. So whether the minister and the pastor argue with the congregation, or whether half the congregation wants one thing and the other half wants the other. So right, I mean, even separate from the butting of heads of religion, spirituality, and mental health at times, religion itself, it has its own interesting intra-religious politics. Sadly, when you involve humans, this is what happens, right? You interject humans into anything, for better or worse. There's great things about humans and human nature, right? We are so creative. Emotions are things that AI bots will never be able to experience and replicate in a purest sense. We bring so much to the table, yet we bring so much chaos. And so, I grew up in the church and as a Korean American, and the Korean American, or the Korean version of church, it's a shame-based form of Christianity, shame and guilt-based form. It is the epitome, right? Culturally, ethnically speaking, a lot of Asian cultures are shame and guilt-based, and then we somehow have woven that into Christianity itself, right? So, no, definitely, it's religion is fascinating. Religion is fascinating. So, but again, guys, it's all about you. It's all about you, right? You can take spirituality and religion in a positive way, a negative way, a healthy way, an unhealthy way. So that's the most important thing. Let's end on this note. You have the ability to influence what role spirituality and religion will play in your life. You have the influence and the ability to set boundaries for yourself and to set boundaries on these religious spiritual communities. It's important to realize that. So whether you've had healthy, unhealthy experiences, good, bad, if you want to use those labels, you have to remind yourself that was then. Today is a different day. Today presents an opportunity where I have the ability to influence how I want to define that relationship, how I want to define boundaries in my connection towards, a religion, a religious body, a church, a temple, a mosque. You're in the driver's seat, guys. You are, right? So remind yourself, you have the ability and the opportunity, is probably the word, the opportunity to define that for yourself. Don't let others define that for you. Don't let others impose and force their beliefs onto you. You decide for yourself. Okay. All right, guys. Well, thank you for joining in. It was a very interesting topic. It was interesting for me to even reflect on some of these things before I even, prep for this show. So I really appreciate you guys even kind of getting those creative juices flowing. So keep those ideas coming in. I should be posting one of my more evergreen videos tomorrow at some point, and I think it's pertinent to this season, especially for those of you who are masochists like me, living in a very cold state like Illinois, where winters are cold and daylight is short. The evergreen video I will be posting tomorrow is going to be on bright light therapy to help with seasonal depression, especially the seasonal depression subtype that starts in fall and winter when daylight is going down. And again, I'm a true believer. I am a true believer in bright light therapy. It is not talked about enough. Okay. There is a true evidence-based, even with randomized clinical trials, not like poorly run sham trial, but randomized clinical trials, numerous meta-analyses, even as recently as the past couple years, that show that bright light therapy or light box therapy is truly a legitimate intervention for those who have seasonal depression, especially that fall winter subtype. And it's just, in my opinion, just not talked about enough. I don't think enough people know about this, and it's sorely underutilized, in my opinion. Now, the problem is when I've recommended this to patients, um, there are so many logistical mistakes made, in how they utilize the light box therapy. So that's really what the emphasis is going to be on the video. It's not going to be about just all the evidence and the research behind it. I really just touch on that for like a minute. It's really more about what mistakes to avoid, not buying the right type of light box, because you often people are wasting their money on the wrong kinds of light. What kind of lux, L-U-X, lux, that light has to emit, what distance you need to be at, how long you need to use it, what time of the day you should use it, etc. So we're really just going to go over the nuts and bolts of how to actually properly utilize light box or bright light therapy for seasonal depression. A couple comments are coming in. Thank you for the ideas. So Carrie says, can you do a video about trichotillomania and other compulsive picking disorders? Sure. Okay. I'll put that on my list. And I didn't forget. I don't know if it was you, Carrie, or someone else that was actually, asking me to do a video on a specific subtype of OCD. I think it was POCD. And I know it's kind of a very stigmatized subtype of OCD, where OCD patients are having, I guess, pedophilic imagery or thoughts going through their mind that are ego dystonic. To be very clear, right? These are not things that resonate with their values, and they're distressing, startling. The patients get disgusted by these thoughts. I haven't forgotten, so I still have that one on my to-do list. Yeah, we could definitely do one in the future, an evergreen video on picking behaviors or compulsive disorders. And then Andy says, I know you've touched on it in other videos, but I would love to hear a live episode about the stigma associated with addiction and the speed bump it can be when it comes to recovery. Yeah, no, I got to write these down, guys. I'm going to write it down right now. So POCD, compulsive picking, stigma with addiction. And Joa says, first time tuning in from South Africa and almost 8 a.m. You're listening to me at 8 a.m. in South Africa, Joa. I appreciate you. Here in Illinois, it is almost midnight. So, wow, that's a big time difference. So I appreciate you tuning in from South Africa. So I thank you for doing that. And I hope that you subscribe. And we do these on Tuesday and Saturday nights, I guess for you. That's what Wednesday and Sunday mornings. But thank you for tuning in, Joe. Hopefully you tune in again and maybe watch some of the other content here. So thank you again, guys. Thank you for the topic ideas. And remember, check out that evergreen video on bright light or light box therapy for seasonal depression for those of you who struggle with depression during the fall and winter months. Thank you again, guys. For you first-time listeners like Joa, thank you for checking in. Subscribe, like. I appreciate your support. And until our next live episode of the Insomniac Livestreams coming up this Tuesday. And remember, this week I am on PTO. Oh my gosh. Let me turn on some applause with my sound machine here. Yes, PTO. So that means I will probably be putting out more evergreen videos, more YouTube shorts, and I will keep you guys posted. So look at the bookmarks. I'm going to try to see if I can squeeze in maybe an extra bonus holiday live stream this week. So for those of you who are insomniacs like me and are going to be up late at night, maybe Christmas Eve, Christmas, whatever, other days this week, I'm going to try to put in a bonus episode of a live stream. So stay tuned for that as well. Until next time, guys, Dr. Andrew Kim, you guys have a good night. You insomniacs, get to sleep, get some rest. I'm going to try to do the same. All right. Have a good one, everybody.